Breaking news on Anatomy Live. My name's Jess and a 67-year-old woman has been admitted to Royal Brisbane Hospital with severe epigastric pain. Late last night she had a rapid onset of symptoms beginning with abdominal pain which spread posteriorly to her lumbar region. This was accompanied by fever, gastrointestinal bleeding resulting in loose bloody stool, nausea and severe emesis. Paramedics say that her urine was unusually discoloured, indicating possible hematuria. Based on these symptoms, the most likely cause of illness has been identified as a renal infarct. Now let's go to Steph, who's going to give us a bit more insight about the situation concerning the anatomy of the renal system.
Thanks, Jess. The kidneys play a really important role in the human body. They are paired, bean-shaped structures that lay in the posterior portion of the abdominal cavity. They are responsible for filtering out metabolic waste and toxins from the blood before excreting them. It is likely that the patient you mentioned has experienced a renal infarct. One of the most common renal infarcts occurs in the cortical radial arteries within the renal cortex. It most commonly occurs due to a thromboembolism or stenosis of blood vessels that causes irreversible tissue damage. It is characterized by necrosis in a localized region of kidney tissue caused by persistent ischemia to that renal tissue. These particular arteries are more susceptible to infarction because they are end arteries. This means they seldom anastomose with other arteries, and therefore surrounding arteries can't help prevent prolonged ischemia from occurring by supplying the area with blood. The result is a renal infarction.
Doctor, what's wrong with Grandma Betty?
She's showing some symptoms that are characteristic of a renal infarction.
Is it serious?
It can be.
How do we know?
We will refer you to a radiologist to do some further diagnostic testing. Hi, I got a patient who's showing some symptoms of a possible renal infarction. Like, you do some diagnostic tests and see what it is.
Perfect. So for this presentation, we would do a computed tomography angiogram. We'd use the late phase injection of contrast and the 40+ Hounsfield unit to clearly see the soft tissue and see that diagnosis. Okay, so we have the results here for Betty's angiogram. As you can see on this left kidney, there's some darker, more radiolucent tissue. That's the infarction area with the necrotic tissue. Just to show you the comparison, I've shown up an MRI from a previous patient. You can tell that in this image it's very difficult to see the infarct, and actually the necrotic tissue almost appears similar as the healthy kidney tissue, so that's why we went with that CT angiogram.
Well, the stem here from the clot here, that's this part called the left atrial appendage. So it would embolize, the clot would embolize and travel to the kidney, and that's where you get your renal infarction.
How can we stop this from happening again?
What we do is get some anticoagulants.
Welcome back to Anatomy Live. Here we are with Betty 3 months later after her successful diagnosis of her renal infarct and the anticoagulant medication. How are you going, Betty?
I feel great. I'm so thankful for Dr. Gonda. For months, everyone had been telling me I just had a urinary tract infection, and it wasn't until my pain increased was when my granddaughter drove me to the hospital.
Due to the wide range of very nonspecific symptoms, such as in Betty's case, a renal infarct is often misdiagnosed, and therefore the exact incidence of this illness is unknown. The severe abdominal pain can mimic any of these other conditions. Additionally, due to the similar semi-radiopaque appearance of the necrotic tissue in the kidneys on a computed tomography scan, this can lead to misdiagnosis of pyelonephritis. The difference between these two cases in CT imaging is the presence of perineal inflammation in pyelonephritis compared to the inflammation and necrosis of cortical radial arteries in the case of a renal infarct.
This is a real-life example of how anatomical imaging can change human lives for the better. This is Jess, and I'm signing off on Anatomy Live.